I am Dr. Patrice Berry, and I'm a licensed clinical psychologist. And one of my viewers asked me to cover this topic, and I'm going to combine a few different things all in this one topic. And later, I'm going to go back and add in the timestamps. And so, if you want to hear one of these specific topics, but if a different one might be triggering for you, come back and watch on replay it's Sunday afternoon, so by Monday I'll definitely have the timestamps up. But we're going to be talking about myths related to death by suicide, a few facts and stats on thoughts and those different things. We're also going to talk about some resources. Anytime I talk about these topics, I want to make sure that I provide resources. Traumatic grief, because there's grief and then there's traumatic grief. Prolonged grief is a newer diagnosis in the DSM. And so I definitely want to talk about that. Grieving the loss of a child. That's where I have the banner going down at the bottom, just so that anyone joining as we're talking, they know that we're talking about a sensitive topic. Resilience. We're going to talk about resilience in general and then also resilience in the midst of grief. I want to make sure to give tips for survivors for coping after community violence. And then also including, because someone asked me to cover coping with negative news, because there's a lot in the news right now. And so we're definitely going to talk about that. And then we're going to have questions and answers. As I'm going, I will just take a look at the chat for anyone joining live. Hey, Cat Lady. Hello, T. Welcome, welcome. And then anyone watching on replay, I truly appreciate you all. And I want to make sure that I'm covering this in a way that can be helpful. And this also, the reason why I started with this topic, because I asked y'all for a list of like some recommendations and tips that might help. And the reason why I really wanted to do this was because I know that people in my community have been impacted by things like this. And watching the Maya trial, I haven't liked how the lawyers have covered Beata's death. And legally they're correct. And I'm talking about the defense lawyers. They have been using some language that I don't think is particularly helpful, especially as we're watching in general. So I wanted to make sure to talk about this is how we should talk about this type of loss, and here are some tips on how to handle this. Um, AKA the cat lady. I see in the chat, and I don't have words. I have worked with people that have been in similar situations and that have lost loved ones by this type of loss, and the grief, like I said, it's not the same like typical grief. I hope that this resource is helpful. So let's first start off with some myths. All right. And the language, the way that we say it is we call it death by, or for YouTube purposes, I'll say unalive. But when we're talking about these topics, the myth is that talking about it will increase the chance that a person will act on it. And I want to make sure to make this bigger so people can see it. There we go. And that's not true. So actually talking about it can actually reduce rather than increasing the likelihood that someone might act on those thoughts. And talking about it helps destigmatize those types of thoughts, where someone can get the appropriate help and support. The family can monitor. We can make sure that we have certain safety things in place, because it can happen where an individual where they didn't talk about it at all, and then there might be this act. And so sometimes there's this thought that, oh, if we bring it up, that'll increase the likelihood that someone might act on those thoughts, and that's just not true. Another huge myth is that people that talk about thoughts to unalive themselves, that they're just seeking attention. No. Often people that have these types of thoughts, they feel all alone and they're not wanting to be a burden on other people. And so it can actually be very kind and sensitive and show them that you care by asking if they have those kinds of thoughts. The only caveat for that is for borderline personality disorder. Sometimes there can be statements that are made. And the way that I see it is that the individual with BPD, they struggle with getting their need for attention met in healthy ways. And I wouldn't underreact, but I would focus on safety so that if I do have a friend that if I don't answer their phone call, if they immediately start making threats, then I would have an understanding with them, like, hey, if you make these kinds of threats, I'm going to ask for a welfare check. Like, that's really important. And the fact that people seek or need attention, that's a normal human thing. Some people don't seek that attention in healthy ways, but the majority of people that have these types of thoughts, they are not seeking attention. Another huge myth is that it can't be prevented. And while it can be unpredictable, people that have these types of thoughts are often in intense emotional pain, feeling hopeless and helpless, and have a negative view of their life. And there are specific interventions that can help a person that's having those types of thoughts. And I'm also big on the community supporting as well. And I found in the resource, when we talk about resources in just a moment, I'm going to share some things, some hotlines that I hadn't heard of, because some people don't like the 988 hotline. I totally get it. So those are volunteers. So the people that work the 988, the crisis hotline, they might, so they're overseen by licensed mental health professionals, but some of these people, they are volunteers, and everything is not perfect. I've heard of situations of people having negative experiences, and so there are some other options. Or if somebody is at a higher risk, there are resources and treatments like dialectical behavior therapy, where therapists can be on call to be able to support a client when it's needed. All right. This is the one that I really wanted to talk about because I've heard this type of language in the Maya Kowalski trial, that people that take their own lives are selfish, cowards, or weak. And that is not true at all. And this is from the Mayo Clinic. So, and I have all the links for the articles that I'll be sharing. But what this goes into is that often people that we lose this way, they're experiencing significant emotional pain, and they've gotten to the place where they've lost hope. And so as a therapist, my first goal is to help them find hope, to help them create and develop a life that they want to live. My goal is to help reduce pain. So we look at different pain points in their life. I work with people that do have chronic thoughts like this, chronic thoughts of unaliving, and these are some of the interventions and things that we do. And then sometimes the individual is feeling like no one cares, and that's often the depression lying to them, and they often get to such a dark and deep and hopeless place that they just can't find or can't see a way out of it. And that's where having a supportive community, having supportive people around, that can really be a positive factor. I've worked with some people where they don't want people to ask them, like, they want people to ask how they can support, but they don't want people to make, because sometimes they feel like such a burden. They don't want people to feel like they're, like, I don't know, changing their plans, or that they're making a huge deal for them. And so that's where each individual is going to need something different. These are just general tips. I work a lot with families. I work a lot with safety planning. So anyone that I'm working with that has these types of thoughts, we talk about their reasons for living, the things that help them not act on those thoughts. And And then there are situations where, based on safety, based on risk, where we have had to talk about, because it seemed like there was a biological depression. So depression can be situational. Depression can have a biological component, and there's a lot of different things that can go into how a person is feeling. There are medications that can help, but there are also medications that can make the thoughts worse. And so that's where, as a therapist, I try to monitor my clients, especially in teens and young adults. I believe it's the SSRIs, the serotonin reuptake inhibitors, that those types of medications can sometimes increase these types of thoughts. And so I definitely monitor that with the people that I work with. Um, and so there is a myth that teenagers and college students are at the highest risk, and that's not true. It's actually individuals between 45 and 64. And then this article, I believe, is a little older, as from 2021, because more recently there has been an increase for ages 10 through, I think, 24. And we've really been watching what's been happening with kids, with the youth, with youth getting hopeless, with young people feeling, losing that hope. And that's where, when we talk about the news later, that can be really important. Just because there's so much stress that some people are looking at the world and they're thinking, this is all too much. And so trying to find safe ways to support people within their communities, that can be really helpful. Um, uh, Another myth is that, limiting access to lethal means doesn't work, and that's not true. Limiting that access for individuals where it is appropriate, that has been seen to help things. Where, if I am working with someone, if they do have access to a weapon, we talk about maybe the weapon being one place and the ammunition being another, and we talk about, like, the safety things that we have in place. Or if I'm working with a child or teen and there are weapons in the home, we talk about how to manage that as well. And then also people not making conscious. My child is just getting his iPad. We know that, what my weekend stream, you're good. Lexi, so Epic, okay. He was getting settled for the iPad time. All right. And then, it's another myth that sometimes it can, now there are situations where it truly occurs without warning at all, but I did wanna talk about what are some common signs. And so, talking about it or making statements, starting to put their, so, like, giving away valuables, having intense mood swings, being preoccupied with, death, dying, or violence, increasing use of substances. So substances reduce inhibition. So the things that person wouldn't do sober, sometimes under the influence. And so that's where, if I am working with someone that's having these types of thoughts, we try to manage their use of specifically alcohol, because alcohol is a depressant. And their research has shown that there can be correlations with things. The individual, saying goodbye or having personality changes. And then the last myth is that therapy and medications don't work, and that's not true. They actually can work. All right, let me come back to the chat. And yes, so Nissa, I heard about this. There was a pastor in Alabama who is, I believe, they were exploring their gender identity, and they were outed on Reddit, I believe. And it's an African American pastor. I believe they were in their, I want to say, like, 30s, maybe. And it came out that the individual was, they, like, exploring a trans identity. And Alabama in general, mm, um, especially being Black, and then also trans, and then also a religious person, all of that shame that can come up for an individual. I work with a lot of individuals in the LGBTQ community, and often they feel like they have to choose, especially as a person of color. Sometimes they felt like they had to choose their identity, and that they really lost a part of their community when they did come out. And but that situation was just very, very sad. I agree, it's extremely frustrating when people talk about it being selfish and how harmful that is. Welcome, Brooklyn. Thank you, thank you. Truly just wanted to cover this because as I do, so I like to look at the trials that are covering different loss. I saw that. Oh, I want to say the mom that she had it was her children, and she's in a psych hospital now awaiting trial. I saw that there was an update on that case. And because basically the prosecution is not believing that individual was trying um to go for themselves. I get extremely concerned when I see um murder suicides. That is just very, very troubling. And often there is a lot of conflict. There's a lot of other things that are going on in those situations. But these things, these situations, these conditions, and this one didn't have it. I saw it on a different one. The fact that death by unaliving oneself, it's not always a person that's severely depressed. So sometimes it can be a situation where it's a intense crisis that happens all of a sudden. For example, with financial crisis. If like back when markets were crashing and all of those things were happening, often people would be watched for those types of behaviors because they were concerned about their safety. So sometimes it can be based on an imminent crisis, but it can also be um, a situation that's related to medical issues. So somebody that has, let's say, like a terminal medical condition, or someone that has um different that has severe mental health, and then an imminent crisis, financial stress, um, of the loss of someone else. And then if it happens within a family, we watch the rest of the family members very closely, because an individual doing it within the family, we just watch the family, because sometimes that can be a risk factor. And so making sure to provide that safety. In 2021, so these statistics are for the American Association of Suicidology. This is an actual branch, I believe, of I want to say, but this is an actual organization that studies this. And in 2021, 12.3 million adults, and I want to say this is in the US, seriously had these types of thoughts. 3.5 million made a plan, and 1.7 million made an attempt. And in the prevention month, we often talk about how individuals getting that help and support, that can be that really can be a huge protective factor. So just knowing that someone cares, knowing that having a safe place where they can talk about the thoughts that they're having, or where they can just explore and try to gain that hope that they might have lost along the way. Here are some resources, and I was surprised. So I knew about the 988. I knew about the crisis text line, Trevor Lifeline, and that's specifically for LGBTQ plus and youth. There is a Love is Respect, and so it looks like this is for this. I was just surprised at how many different. So there's a domestic violence, there's one for SA, then NAMI, SAMHSA has a hotline. There's human trafficking. There's Trans Lifeline. There is a veterans hotline. And I'm trying to avoid words that the tube doesn't doesn't like. But so I have this linked below, but I wasn't aware that there were this many available. Um, in moving into talking about traumatic grief, because when an individual does have a loss like this, it doesn't feel like typical denial, like it. An individual typically doesn't go through the normal stages, because what this type of loss also brings up, it also brings up shame, it also brings up guilt. It can bring up, like, did I miss something? There are all of these unanswered questions, many of which will never be answered. And so that's where, with clients, the survivors that I work with, individuals who have had a family member that they've lost in this way. And this also applies to people that have been lost to violence as well, but there's an additional shame, I think, that's associated with this type of loss. And there can be a secrecy, there can, because there really can be judgment, which is why I wanted to talk about this on this stage, because, and I think the opioid epidemic kind of, because I feel like that type of loss, so losing someone to an overdose, that's like a similar shame that can come up for the family, where they can really feel like there aren't as many supports available for them, and that their grief is just very, very different. And so being able, I wouldn't send someone that has lost someone, so either that has lost a child, that has lost um, somebody by unaliving themselves, or that has lost somebody by overdose. I wouldn't send them to a typical grief group, because it's just it's not at all the same. So I often try to send them to resources that are within their like, so to other survivors of suicide loss, because that group, they are going to understand things in a way, and there's going to be more of a connection. Sometimes it can be triggering, and so that's where people have to determine, is working with a therapist one-on-one, is that gonna be better, or is working on this other stage? And, that often what the individual comes to is, how do I find a way to get back to this new normal in the midst of my grief, in the midst of everything that's going on? And that's where I want to get to that resilience part next, of what are some things that we know can help build resilience in survivors, can help build resilience in people that have witnessed or seen or been through just horrific and tragic things, because there are things that we know do help. So what is traumatic grief? It is, that happens based on, it's often sudden and unexpected loss, or it's the matter in which that it happened. So often, so losing somebody due to violence, or in this type of way, that can often add an additional layer to the grief. And um let's see. Prolonged grief disorder is also called complicated grief. So this is a newer diagnosis that was added. So bereavement was the only diagnosis that was in the DSM-5. No, DSM-4. Yes, because we're on the DSM-5 TR now. So in the DSM-4, the only diagnosis was just either bereavement or PTSD or adjustment disorder, where you would kind of try to figure out, where is the client's symptoms falling. They added this prolonged grief disorder to explain complicated grief. That some situations, that even 4 years later, an individual might still kind of be have difficulty re-engaging in their life, be unable to go in the room where it happened, or that an individual might still have severe symptoms related to grief, but it's deeper than just typical bereavement. And so they added this diagnosis. And I just give that as like for information. The shock and unexpected nature of loss can be traumatizing and trigger intrusive, preoccupying thoughts or bodily responses. And so that's where, after a loss, it's so important that an individual takes care of their mind, their body, which is so hard to do because and all you want to do is just so often people they want to just not exist. They don't want to feel. They like the pain feels like it's too much. And so that's where finding a safe place where you can open the lid on it a little bit. I love giving grieving people a safe place to just open their grief safely in session with me. And then we get them back where, okay, this is where I go to experience it. And then outside of that, like I try to get back. I try to, go to the gym. I try to eat 2, 3 times. Like, I try to reengage my life in these ways, but I know that this safe place is where I can open and experience these feelings. Um, I often like to talk about that being a container because sometimes grief, it can permeate every aspect of someone's being to the point where that's all that they can see. And sometimes being able to find ways of even looking at that loved one thinking, "Would they want my life to stop?" Because every person I've worked with, they've always the loved one that they're grieving would have wanted them to be, I'm gonna put happy in quotes, but they would have wanted them to move forward. They wouldn't want them to be stuck because sometimes there can be grief of, how can I be happy again and I don't have this other person? How can I ever smile or experience joy? Like, how can I do that? I'm not honoring them. And I think that's one-sided, and it's understandable. So I totally sit with my clients in those feelings, and then we also try to think about the life that the loved one that they will forever grieve. And that's how I see grief anyway. I see grief as, it's not a stage that you move through, or like, so once someone gets to acceptance, it's not like the grief goes away and they never ever feel it again. Um the way those stages of grief, denial, bargaining, anger, blah blah blah, moving through to acceptance. um, I was watching something that talked about grief being a lot like a roller coaster. And sometimes, like, a person, they might just be really, really low. Sometimes because they feel like it's all out of their control, and things can pop up unexpectedly. And that's where the loss can have that traumatic component, similar to a war veteran that maybe is triggered by fireworks. Somebody that's coping that type of grief or loss, there might be a song that comes on that triggers uncontrollable crying, or like a really intense emotional response because they're still grieving, which, once again, I help people sit in that is okay. I often worry after a traumatic or tragic loss, if people, because some people go on autopilot and they don't feel at all. And then a year or 2 years or 3 years later, all of a sudden they fall apart, but it's because that grief was just building up inside. And we have to redefine what it means to be strong. I will say that again and come back to the chat. We have to redefine what it means to be strong. Sh- to me, strength means crying. There can be vulnerability in the midst of strength. And that's where, if someone's had a loss, I don't say, "I'm sorry for your loss." I don't say, because there are things people say that make things worse. So I don't say, they're in a better place. Like, there are triggering things that people say. What I often say is, "I don't have any words," 'cause I what I say is, I'm here to support you. Let me know if you need anything." And then that's where I often follow up with the person, because often right after a loss, the individual is flooded with support. The family, everyone is just flooded with support immediately. But that first year is often because it's almost like learning to walk again, because they are trying to exist without someone that they love. And that is extremely hard. And so I often reach out to the individual 3 months later, or 6 months later, or a year later. And then I let it be up to them for, do they want to not think and just like, do you need a distraction? Like, if we're together, do you need a distraction, or do you wanna talk about your loved one? And that I'm talking about me as a friend, not as a therapist. And even as a therapist, it's a similar thing, but when I'm supporting someone as a friend. I think I've mentioned it here before. There in my family, we experienced a pretty traumatic loss, and I will never be the same. I will forever grieve my loved one, and they hold such a special place in my heart. And there was a period of time where I stopped doing grief work, and that loss actually helped change my perspective on grief, because in the midst of it, I saw people trying to appease, like just wanting people to like not cry, or just wanting people to be okay, when what they experienced, it was totally normal that they were not okay. It was, they needed to feel what they were feeling. They needed to let it out. And there is something about witnessing someone else's pain and not trying to make it go away. So in my office, this is something that therapists sometimes do. So if someone is crying in my office, I don't immediately offer them a tissue, because subconsciously, giving someone a tissue when they're crying is kind of like saying, could you please, like, get it here, like, get it together?" So if someone is crying in my office, now I have the tissues, like, available. They can see them, and, before they leave, like, because like, if their mascara is running, like, I don't like, I want people to, like, leave feeling okay. And this also comes from my own experience in therapy. So the best therapy sessions I ever had, I just bawled the whole session. Like, literally, the whole session was just me just snotty crying, and it made me feel so much better. And so this is a great question. So what makes grief complex? It's the matter in which, so if it's unexpected, if it's by violence or force, and also if it's, I don't think it's natural for parents to bury children. So like, that is always going to be traumatic. A parent burying a child, that is, and even it could be like a 60-year-old parent burying a 20 or 30, but like, that is a significant loss. That is, it feels unnatural. So I'm prepared. Um so me and my mom have a very, very good relationship. I kind of have a more like, but I've thought about, and whenever, God forbid, something happens to my mom, not God forbid, but like, because it'll, whenever something happens to my mom, I'm gonna like take a break. I'm gonna have to do self-care. Um, I'll eventually be okay, but like, it's because she is a significant person in my life. She's one of my best friends. Um, but then it would be, but if she had to bury me, like, that would be, that would be a lot. And I'm not even saying the other one, because 'cause I'm on the verge of crying now, because I can't even think about, like, my little person. I have worked with parents that have had to walk that journey, and that have had to do that. And the one thing that I do for my clients, because it's kind of a red flag if you're talking with your therapist and if they like lose it. Like if your therapist is like boohoo crying. So I have like shed a tear for a client. I've like in session, a client was just sharing something heart-wrenching, and it really did touch my heart for them. Most of the time most of the time I don't cry. Um, Often, and the times that I have, it was horrific. It was really, really difficult things. And I will stop being a therapist if somebody can ever share horrific things, and I'm just like, "Oh," like, and if I don't feel something. So, I definitely care, but it would be unethical for me to like for their pain to become my pain, or for like me to be crying for myself almost, because I've worked with people that have went to a therapist, and the therapist, like, their story was too much for the therapist, and then the client felt like they were too much, like they were too broken, or that they were beyond help. And I just think that that therapist just didn't have great, like Sarah said, didn't have great boundaries, and needed, to manage their own emotions, because or just to say like, this is more intense of a case than I typically work with. Let me help you find someone that can support you. I'll continue to see you if needed, like until you find the right fit. But if I am working with complicated grief, if I am working with significant loss, I would wanna make sure that the therapist is equipped to handle that. Alright, let's go back to the article. Alright, and so, once again, evidence suggests that people are more likely to develop complicated grief if the circumstances of the loss are traumatic in some way, like an accident or natural disaster. Um and then also, the loss of a child can be particularly traumatic. So there are symptoms of traumatic grief. We aren't gonna get into that. Y'all know I am not a fan of BetterHelp, so we're not gonna do that. We're gonna find a licensed therapist in our area. Um, Ways to deal with traumatic grief. And it's so hard to do, but it works. I promise you it works. So the person trying to get back into a routine and having some structure, because just if they're able to get back to work at some point. Now, I have worked with people where in the moment, things were they weren't able to return back to work. They needed a period to stabilize themselves emotionally, and before they were able to return to work. But most of the people I work with, just financially, that they weren't able to take unpaid leave, and so they did have to, but having that routine of going to work, that for a lot of people, that once they were able to get back into that, for some people that was helpful. Know that your feelings are not uncommon, that there are lots of people that feel the same way, because sometimes it can be really lonely, when someone is going through a traumatic loss. Acknowledge how you're feeling. Once again, that's about not stuffing the feelings, because when an individual pushes them down, they'll often pop up unexpectedly, and it causes more problems down the road. But so stuffing is different than containing. So containing the emotion is, okay, I want to try my best to not, like, while I'm giving a presentation at work, I want to try my best to not like start crying in the middle of that. That's different than when I'm safely at home with my partner, being able to feel my feelings and grieve. that's a little different. But I have had some people where it was invading every aspect, where we had to talk about it's okay to do something that makes you happy, because often they would feel guilty about being happy, about doing things that made them feel good. And so being able to find safe ways to do that. Finding some type of expression through journaling, music, through art, finding some type of expression, I think, can help. And for some of my clients, if they needed to cry, we sometimes talked about watching something sad on purpose. And maybe it wasn't like maybe a grief thing would be too close, but maybe it was like something else just to kind of give themselves permission to cry. They would watch a sad movie or read a sad book, and then making sure to lean on others and get support. That can be really helpful. All right, coming back to the chat. Let's see, let's see. Welcome, welcome. Hello, Law Nerd Amber. Let me just make sure. And I'm gonna save time for questions at the end. Yes, safe places are so important. Ooh, good question. Do I think Beata's could be directly related to the treatment she received at the hands of the hospital and court? I'm glad you included hospital and court. And I think this will be the defense has a good point, but I have watched the Take Care of Maya video. And to me, the emotion of the docuseries seemed to focus a lot on Dr. Smith, on Kathy Beatty, and then also on the court and the judge denying that hug. But I do think the hospital withholding information that went against the Munchausen diagnosis. The fact that the hospital was treating her for CRPS while mom couldn't see her because of CRPS. And let's say Maya did have conversion disorder. I don't believe she did. Pain is incredibly subjective, and I'm not a medical expert in that, right? And there were medical experts that did diagnose her with CRPS. With conversion disorder, you wouldn't remove the child from the parent. The hospital also didn't provide any family therapy either. And so, let me see. Lon Lubber says, do something, anything that has helped. I don't know. Okay, that might have been a different conversation. But so I definitely think if I was on the jury, I would have to see what the claim is. So I'm concerned about the EEG room, the fact that the family expressed concern about Kathy Beatty, and then, ooh, it was Recovery Addict that did the video with the hands. Recovery Addict did a great video comparing Kathy Beatty's hand to one of the hands to like I think it was a left hand in one of the pictures, and that it looks a lot like her hand. So I definitely do think there were some things that happened that were inappropriate. Depending on what the judge says, I I do think that the hospital and the court, it created a very difficult situation for mom. And if it's true that people were telling Maya that she would never see her mom again, and it sounded like everyone around Beata was telling her, like, just agree to, like, not ever give her credit, like, just do these things and you can get her back. And, because I think some of those audio clips, I don't believe that has come into the trial. I heard more on the docuseries than has come into the actual trial. And so it's a really, really complicated case. Um, so the intentional infliction, so the hospital, those text messages after her loss, so those text messages about that the child's better off, calling her ketamine girl, like, I think there are some things that aren't appropriate that happened, And I'll be really interested to see what this jury decides and if juror number 1 is truly excused. All right. We'll be really, really interested in that. But all right. So let's get back into the loss of a child. All right. All right. So no parent is ever prepared for a child's death. And this is from cancer.net. I do believe, yes, I have that one in the description as well. And especially young children, um, and and um, when because you're also grieving the life that you wanted a child to have, the things because sometimes, and it's I'm just gonna say it that sometimes when someone in their 80s or 90s, like, sometimes it's still a hard loss, but when it's a child, we're also grieving the ambiguous loss. An ambiguous loss is something that I can't it's not an actual memory, but it's what could have been. It's just I can't even put it into words. The loss that I grieve personally, it was a child, and so grieving the lost birthdays, grieving, the lost graduation, or all of these different milestones and everything, that just adds an additional layer to grief. And so there are common grief reactions. Often there are reactions that come up around specific times of year, which is why I wanted to talk about this with the holidays coming up. Yes. Yes. You said it. So the holidays, or those the year starting, birthdays, those times of year can bring it up. And that with child loss, the hard thing is that no other child is ever going to fill and neither should they be expected to, but because sometimes people won't understand the loss when the person has other children, but that doesn't replace it. I also feel similar to pet loss as well. Like, lose a pet can kind of, it's like an extent, like it kind of can be like your child. There are grieving the loss of a pet, grieving the loss of a close member of the family. That can definitely bring up a lot. And so I often try to encourage people to create positive rituals or positive memories. There are to celebrate the anniversary of my loved one, we like to spend a day outside, and it's normally a sunny day. I don't know, I don't have the memory to know if for every year, if their birthday has always fallen on us on a sunny day, but there is memory making and there's meaning making that we've made in the midst of all of that pain. And it truly is a pain that there are not there it's just it can be hard to find the words for. And so um and around the holidays, for some people, they do have a stocking for the individual, that remembering, even though it brings up pain, not seeing their stocking would bring up even more pain. And so that's where families kind of balance as a group what how they remember and how they move forward. And so, yes. Yes. So this type of advice is the worst. Like, just go, no, often the loss of pets, the loss of children, there is no other thing that will ever fill that space. So the way that I see grief is love that needs to be expressed. It needs a safe place to go, because left inside of me, it will just, oh, it'll eat me up inside if I just keep it inside. So the way that I grieved was, I made tutus I made handmade tulle tutus for little girls, as a way to it was like a repetitive, it was a creative, artistic thing, and I was able to give that to other people, and that was very cathartic for me. Every person finds their thing. The holidays often we also have like less sunlight, so like there can be seasonal depression that comes up as well. And so like the holidays can really just bring up a lot. But sometimes what can happen is that different parents can grieve differently. We have to help siblings grieve as well. And then um, making sure to, as much as it hurts, and while a person is grieving, to ask for help and support when they need it, to not be afraid to say their name or think about them. And I often give that advice to people supporting them as well, because often the person grieving loves it, or not love, but like instead of acting like the person didn't exist, like, talking about them can sometimes, and that's where, like, you have to talk with your loved one to see what helps, but yeah. And then there can be, difficult questions that come up, and so thinking about how a person might answer those questions. Um, Also, I wanted to mention that, miscarriages as well, um, even that can also bring up significant grief and loss. And it's another one of those ambiguous loss where like I never got to see. And that's where some people will still name their child, or they'll still um uh they kind of still have that connection. When asked about the number of children they have, sometimes they'll see, I have 3 here on earth and 1, and that's where each person kind of finds the language that works best for them. All right. Let's talk a little bit about resilience. All right. Let me come back. All right, good. So with resilience is something that can be developed within all of us. It's not a specific trait that people have or don't have. It's more of a process. We can build resilience. And so let's talk about defining it. What is it? Let me try to make this a little bigger. All right. And so resilience is a process and outcome of adapting to difficult or challenging life experiences through mental, emotional, and behavioral flexibility and adjustment. And often people need support to do that. Okay. And there are a number of factors that go into people coping, how they view themselves in the world, the resources that they have available, and then the coping that they have. And so here, because this is apa.org, and so there are tools for building resilience guide for parents and teachers, because we want to build resilience in kids, and then resilience for teens. I have a podcast episode coming up with Casey Davis where we're going to talk about resilience, and I will share that on the community tab, because I don't know if it's audio only. I don't know how it's going to be released, but once that is available, I will share that on the community tab, because we're going to talk more about resilience. And then wanted to talk about resilience in the midst of grief, because often the typical advice for grieving is not particularly helpful. And um and so often people don't feel like they fit neatly into the the categories that are available. And so being able to know that grief is a common human response, and then also so is resilience, and how it can be there are strategies and things that we can do that can build resilient grieving. And this is an individual that has experienced loss themselves, and they're sharing their personal tips. And their first tip is to accept the good, drawing on a large body of research about gratitude. So, being able to choose life in those moments, to not lose the people that they still have and the people that are still there. I've worked with people that while grieving the loss of one child, had to find the way to support their surviving children, which can bring up survivor's guilt. Like, it can bring up so much with an individual. And it can also bring up crisis of faith. Like, it can bring up, how could God let this happen, and all of these spiritual things that can come up as well. And that's where, as a therapist, we work on the grieving and the feelings. And I have had some people that, in working through their feelings, they did reconnect with their faith. And then some people that weren't able to. Just the size of the loss, the size of the hurt, like, they weren't able to go back, which was like, it wasn't my job to push them one way or another. It was just my job to support them. We want to hunt out the positive emotions. So after a negative event, our brain is automatically going to focus on what's wrong. That is what survival brain does. And after a traumatic or tragic loss, you go into survival mode. And a way to be resilient, or as resilient, or a way to thrive, is to try to find the good, and which is very hard. And that's where I don't think it's a either or, where I'm not going to ignore the bad, but I'm not going to ignore the good either. That I'm going to be able to feel both at the same time, which can be hard. But that's a process of, it doesn't have to be black or white. It's learning to live in the gray and walk that middle path. That I'm grieving, and I had a good time meeting with friends for lunch. I'm hurting, and I'm still finding ways to try to take care of myself as best I can. Like, that there can be an and instead of a either or. That people can find ways. And it takes skills, it takes work, it takes support. Okay. Like, these, because naturally what you want to do is just lay in bed all day. Naturally, what you want to do is just disappear. Those are the things, but by doing those things, it often makes the grief, though, that those the negative emotions associated with grief, it makes that bigger, where then the person, they can end up getting stuck. And so, once again, we're talking about establishing routines and rituals and ways to keep memories alive. I'm a big picture person. Like, that's something that I really like to do and share. Um, but yes. All right. All right. Oh, my book? Yeah. So, I have a book. It's called Turning Crisis into Clarity: How to Survive or Thrive in the Midst of Uncertainty. If I make myself bigger, it's over there in the corner. It's right on Amazon. It should be in the description of everything. And chapters 1 through 6, I wanna say, or 1 through 5, are all on surviving, just getting through the crisis. And then chapters 6, I believe, through 12. And chapter 12 is just resources. It's just resources. Yeah, so right on Amazon. Yeah. Yep. Get on Amazon, and it is available in Kindle, audiobook. I recorded the audiobook myself with my processing, because I have a reading processing thing. It was a lot of work. I don't know if I'll ever record a book myself again. I don't know that I will. But I wanted it to be available on Audible, because I only look at books on Audible. And so, yes. So for my members, I did a member drawing, and once I hit 10K, because I'm close to 10K, I'm probably going to do another members only drawing again for the book. And so watch out for that. I'm really close to 10K, and so I'll probably do that. Yes. Okay, Brooklyn, let's talk about this. So some of us feel emotion so much more than others. I always think I'd rather have feelings than not be able to feel anything. And to me, feelings are what make us human. And now, if I feel emotionally reactive, because so my thing is, it's okay for me to cry. I try to not cry in Target if I can. Like, if I can. Like, now, if like I said, after a major loss, like, I might lose it in Target, like, that's it that could happen, but, I want to be able to feel my feelings and also be able to manage them, but there are situations, so after I got and I'm breathing to, like, the worst news I've ever received in my life. That day, I was so glad I got the phone call once I got to my house. Because if I had been driving, I would have had to pull over. I would not have been able to drive home after I got that news. I'm really good at managing my emotions, and in that moment, my emotional reaction was 100% normal, okay? So how I felt in that moment and how I feel to this day, because grief is love. So the grief I still feel, that is my love that I will forever have for my family member. The only reason why I don't say her name is because it wasn't if it was my child, I would have talked about it different. It wasn't so that's why I'm respectful of my family. I've chosen to be on social media. They, and so that's why I don't say or do this. Um, I try to respect and honor them, and because I think that's really important. Boundaries on social media, I think that's really really important. But being able to um I'm so glad that I still feel that love for her, and, she still brings tears to my eyes, and I can smile when I think about that now. Now, after it happened, I stopped working with grief for, I think, a year, maybe a year and a half. Anyone that I had that was currently grieving, I got supervision just to make sure that my stuff wasn't bleeding over to anyone else. And so therapists, because we live our lives too. So we are human. And so just to protect myself and to protect my clients, I did not, during that period of time that I was in active grief, that I was actively, grieving. I did not work with people that were also grieving, because I wouldn't have had space to support myself and then also support the other person. That's what I look at as an emotional boundary. Um, and the meaning making that I made out of it is it has forever changed my view of grief and my work with grieving people. I had had other losses. I also, when I was in high school, we had a difficult situation, and it was a parent of a family of a someone I knew. I remember them die them unaliving themselves, and just how, that shook our whole community. And they sent crisis counselors out to the schools, and like, we because a lot of the kids knew the person, because I think they volunteered, and because we went to the same church. Um, but being able to have safe spaces where you can feel the emotion, where you can feel the feels, I think that can be incredibly important. So I view that as strength now, because my view on strength has changed. So to me, strength isn't pretending like you're okay and falling apart at home. Now, if that's what I'm doing to cope and survive, do what you got to do. To me, I find strength in going to therapy. I find strength in asking for help and support. I find strength in all of these other things. Yes. Safe places require boundaries. Exactly. Exactly. Yes. And so I think this is a whole video. Law nerd Amber. Like, I have that's probably I'm gonna copy this, because that needs to be a whole video in and of itself. I have a few other boundary videos. I'm gonna star that one so I can come back to it later. All right. Aw. Y'all know. I think that's why we're all drawn to you. It's the respect and empathy you have. Aw. Your warmth comes through without lacking professionalism while giving guidance and teaching. Thank you all. All right. So now we are going to move in to talking about, let me see. Am I up here? Nope, I'm on the wrong page. Here we go. This tab. Tips for survivors. Okay. After community violence. And then next, we're going to talk about the news. And then I'll be able to answer any last minute questions. But coping with grief after community violence, there's been a lot on the news in general. And as a community, you can grieve. So there are people that are based on things in the news, they have identities where they are grieving with their communities. And that is real. And so grief reactions to I think of it like secondary trauma. So even though it didn't happen directly to me, I can still be impacted based on hearing about it, based on seeing things. That's why with the news, I listen to it, I read it. I don't look at videos, especially of children being harmed or of um of like if there was video of certain like like in the midst of a horrific thing, if things ended badly. If I know things turned out okay, sometimes I can watch, but if things turned out badly, give me a moment to parent. Are you all done? Okay, stay on this side. So you can do YouTube Kids for a little bit. I have about 15 more minutes. Or you can go downstairs if you want. It's up to you. Okay. Thank y'all for letting me parent. All right. All right. And so how individuals can cope with their grief. Um Sometimes what can happen after situations is I can have an increased appreciation for my relationships and for my loved ones. I might become more socially active. I might attend if there's a situation, if there are ways I can protest, if I can do certain things. Sometimes people will kind of because there's a lot of energy that comes up, and sometimes people need safe ways to challenge that energy. But I want people to be very careful, especially as they're if you do watch the news, I would try to limit it if you can. So this is just is my unofficial but we know. So the way the news is made today, it is made to increase negative emotions because people watch longer and sometimes they spend more if they're scared. So our news, if there's an hour news segment, 58 minutes of it is probably going to be all negative. Now there are positive things that have happened within that community, especially fear. Exactly. Cat Lady and Sarah both got that. Fear, okay? So, they're going to bring up that feeling of fear because and I've been so I did it. So, when my kid was going into kindergarten, I bought a little Verizon Gizmo watch that he wore probably, like, 2 weeks. So, as a parent, I was so afraid of, God forbid, if something happened at his school. And this is so sad to say, but it's true. I was like, I wanna be able to say goodbye. Like, I wanna be able to talk to him. I wanna be able to know that he's safe. God forbid if something bad happens at his school. And so I did. I went and bought the little but I wasn't comfortable. He was 5. I wasn't comfortable with him having a phone, but I wanted a way to be able to communicate with him. And, um and he doesn't even wear it anymore. So we are so close to the school. We um and they do their intruder drills. They have and we normally are warned when it's coming up because it's still elementary school And so, kindergartners don't have to do it, I think, until, like, I think it's later. He's in 1st grade now. But he did have to do those drills, and, it's just sad that, like, we have to do these things. Because when I was in high school, I'm 41. When I was in high school, th we had, threats, so boom boom threat drills, we had fire drills, we might have had tornado drills, like, if I was living in an area that had tornadoes. Some places have earthquake drills, but it really is just so sad that we have to prepare our kids for stuff like this. But how to cope with the constant stream of negative news. And so what I personally do is, so I also like to watch comedians talk about the news. And so sometimes I'll watch, I have a dark sense of humor anyway, if y'all haven't noticed. I have a bit of a dark sense of humor. And so I like how comedians take something painful and they make light of it, but like it's still heavy. And often after like certain events, even the comedians will be very, they ground themselves and they say it in a very somber way, but then they kind of like find something to joke about in the midst of it. I personally need that. And so people are experiencing news fatigue because it's just news is more negative. It just is. And so technology can promote consumption of negative news. There's so much clickbait. And because sometimes just the article title. I've also seen here on YouTube, and I think I talked about this in another video, where I've seen like more creators doing like, because someone might be more likely to click on a video that says, "Oh, I lost my job," versus I like, "Yay, I made a positive change in my job situation." Like that people are more likely to click when it's something that's bad versus something positive. That's something that I see on my algorithm, and I try to scroll by it, but yes. All right. People have cognitive biases, and I am gonna do a video. Somebody asked for a video on confirmation bias. I'm definitely gonna do that. But, a cognitive bias is a systematic, unconscious defect in reasoning that impacts how people interpret the world and make their decisions. Cognitive biases differ from cognitive distortions because they are a part of how someone thinks, whereas cognitive distortion is caused by strong feelings of panic or despair, blah, blah, blah. All right. Regular consumption of negative news, either all at once or throughout the day, can make people feel like they have mean world syndrome. And this is what this author is calling it. But if I have clients that watch news all day, they often have this view that the world is like increasingly bad and very scary. And now there are legit concerns that happen in our world. There are things that need to be addressed, and there's also good things that happen in our world. There are positive things that happen, and the news doesn't show that part. And so for my people that do consume a lot of news, I encourage them to take a look at the positive. And so consuming too much news can have an impact on your mental health. And and so they talked about Apple. I haven't done this one before. If you're experiencing an emotion, label it, pause, sit with the feeling, pull back, do your best not to indulge in the emotion, let go and explore. Okay. Well, so those are just some tools. Um, but being able to have boundaries in your life around what things are encouraging you and making you feel better versus things that are causing you more stress and pain and causing you more trouble. And so somebody asked how, because they're not agreeing with things the US government is doing, I'm thinking it's with some of the crises that are happening over in the Middle East. And that is where I encourage people to write their congressperson, like talk with people, being able to seek support. There are groups that are supporting people that are the innocent people that are caught in the midst of the conflict. And so being able to some people like financially give to those things, but finding ways in the midst of that to make some positive meaning. And that goes back to what we talked about um with my brain. I'm seeing y'all giving prizes out for was it were y'all talking about who graduated from high school? Okay. Okay. Y'all were talking about who graduated from high school. I'm very easily distracted. We've already talked about why. Hey, Olivia B, I think this was your question. I want to say this was your question. I truly hope that this was helpful. Thank you so much for asking it and thank you for being here. Um all right. I'm gonna stop getting distracted by y'all. Let me know if y'all have any questions on this topic or any of the court cases that I've been covering. I'm interested to see because tomorrow there's gonna be the update on what happened with the deposition on Friday with the Maya Kowalski case. I did, I think, 2 or 3 videos on it so far. Some of it so I've been watching Rob over on Law and Lumber, and then also I watched the live stream with Recovery Addict. There are so this it's like this case is very, very heavy. I am still team Maya. I just am. Oh, you asked your question earlier. Do you remember what it was? Because I don't know that I answered it. If I didn't answer it, let me know what it was. Aw. Creating a legacy has been a great tool to put life and death into perspective. So that's the name of my podcast. So I have a podcast called Legacy Moments that I have with my mom. And our tagline, what is it? Welcome to Legacy Moments, where we have authentic conversations about life, business, and so much more. And so, finding a way to make meaning out of it. I think that's really important. Um, I was class of 2000 for high school because we're talking about our classes here. But yes, okay. It looked like my camera went out for a second. All right. Brooklyn. I meet so many families who experience sudden and traumatic loss, and even though it's my job to help guide them, I always find that I learn and take more from them to help myself and others. Oh wow. That's super awesome that you've been able to find a way to in the midst of your work that could be considered to be pretty like difficult and painful that you found a way to make meaning out of it. So the one thing I do for my own self-care is I realize the people that are in my office I don't worry about them as much as the people that are struggling and in pain that don't have a safe space, that don't have a therapist. So the clients that I work with that struggle with these types of thoughts that have so much going on in their lives, at least they have a safe space to talk about it because there's so many people that don't. Question: how was there not a conflict of interest with social services in the hospital? So in Florida, the social services system is privatized, and that private company, I believe, was sued by the family, I believe, because the family I think there was like a $2 million agreement, and based on this question, so Dr. Sally Smith, it sounds like her finding cases now, I think she legit thought there was something wrong, but she seemed to think there are allegations that she overreported and, like, I think the area that she monitored had some of the highest removal rates in the entire state, I think, and I think so this is my opinion, and Dr. Berry's opinion, Patrice Berry, not knowing the case fully, from what I've seen, it sounds like Dr. Sally Smith had, like, this vigilante almost, like, s so you have to be careful when you work in child protection that you don't feel you're the savior, because you still have to operate within the law. You still have to operate within your role and your scope, and I'm very concerned that she only included evidence that went with her case and left out evidence that went against it, when normally, in my experience, the investigator would include everything and then let the judge decide. The investigator wouldn't only include the information that went with their allegation, and so, we both graduated in 2000. Yay. Alright. So we both had so we missed our 2020, our 20-year. I talked to, like, one person from high school. She didn't even go to my high school. So, like, I went to 2 different high schools, and so my best friend, we met at the first high school. I still talk to her. I don't talk to anybody from high school. I went to high school with the mayor of a local city, and but we're not, like, like, we don't talk, like, so I didn't miss anything not going to the reunion, but yeah. Yes. Did a video, on contractual requirements for medical providers. That's super awesome. So make sure to check that out if y'all are interested in learning more about that. Sarah, you and Matt, you all have been just educating people in the comments, and that has been super helpful, I think. Um, and Olivia, you might take it day by day. And better doesn't mean good. I like that you said better and not trying to feel good, because better might just be a little better than yesterday, but it's going to be a roller coaster. So even I'm not coping with what you're coping with, and, like, I'll have a good day and a bad day. And but they're just days. And so I would encourage anyone that's grieving, that's going through it, that's coping, I would encourage them to try in those more positive moments, less sad moments, to be able to enjoy those as well, because often guilt will come up when people do start to feel better. There can kind of be a sometimes we think we're honoring our loved one by being sad, and I think a person can do both. I think a person can feel sad and also have moments of joy, and also so I don't think it has to be either or. Those are my own thoughts. Yeah, I thought so. The family settled for 2.5 million with related to that case. Yay. Um, the proffer, so I don't think I watched the full, so y'all know I try to work, like, I run a private practice. I have so that's the job that pays me, like, that's YouTube is fun, but, like, I have a full-time practice, and so I do hop in. I saw parts of it, but not all of it. It was my understanding that in Dr. Smith's proffer that, like, the added what how she was in the deposition was more like that versus how she was when the jury was present, and that's interesting to me. I haven't watched Dr. G's video looking at her body language yet, but yeah, that's a whole thing. Great question. Are there ways to vet people before getting into some professions? So, um there are always gonna be bad actors in any setting. So, I think police officers, I think they have to do personality testing, I think, because there are some people that aren't allowed to be police officers, and that the one that had the law enforcement experience, she wore the pink. I think she was from, like, I forget what state, but the lady, y'all know who I'm talking about. The one who was the CPI, like, she was supervising the visits. I felt I don't know why she didn't go into law enforcement. I know that some people that there were red flags that showed up on their assessments, and they weren't able to be in the profession. So my profession, psychology, they try to have um these milestones. So I had to be supervised at my site for a year. Then I was supervised off site for 2 years. And then I did an internship, a whole year, full-time internship where I was supervised there. And then I did a whole year after where I was supervised. And then every year I have to do, I want to say it's 12 continuing education credits. And then also like um, if somebody yeah, and then, like, there are ways for patients, if they do have a complaint, or clients, if they do have a complaint, that they can make those things. I think people can slip through the cracks. I'm so glad that Jody Hildebrandt no longer has a therapy license, but she can still be a coach. So her business sounded like it was more like coaching anyway. It didn't sound like it was therapy. She had other people doing some of the trainings and things, and she did those group sessions. And um, I'm glad she can't call herself a therapist anymore based on the allegations and based on what's come forward and the evidence and the things that she already has been found guilty of with, I think his name was Matt. I'm bad with names. I want to say it was Matt. But people can always slip through the cracks. Is there a correlation between ooh, that's a good question. So, yes, I've worked with some people where so there's non-unalive thoughts that have that harm, and then there are other. And so I've worked with some people that to manage intense emotions, they engaged in what we call like negative coping. And I do a harm reduction approach where we try to find other safe ways for them to engage. So y'all might have heard about like the rubber band technique where anytime they have those thoughts, they pluck the rubber band, and that little bolt of pain, it gives a similar, it's not the same, but it gives like a similar thing. And so sometimes people that have chronic thoughts, they'll keep a rubber band on their wrist and pop it. There are there was a butterfly technique where for individuals that were having thoughts of harm, where they draw like a butterfly on themselves. Often people that have thoughts like that of harm or of unaliving, they often have very, very low self-esteem, very, very low self-worth. They don't think they deserve to exist. Like they don't like often in my experience, the people that end up in my office, that's really common what I hear. And so that drawing the butterfly where they want to harm, what that does is we then protect the butterfly because the idea of not harming themselves, they're like, but the idea of not of protecting the butterfly, or they draw a family member's name, or they find a way to like protect that person instead of thinking about protecting themselves. Like those are some techniques that I've done in session. Um, I hope y'all have a good day. Let me see. I'm still checking out the comments. I hope that is helpful. Ooh, question. Do you know much about grieving the loss of a yeah? Yes. Okay, so that's a whole other video. Okay. Grieving the loss of a living person. So it can often that can be harder. It's like divorce or leaving a harmful relationship because often the relationship might not have been harmful the whole time. And there is a cycle to issues where there is like a honeymoon phase that's positive and good, and there are real connections that are formed, and so that is a very real thing. I'm going to put that on my list as something to talk about in the future. If you search Dr. Patrice Berry grief, a video about like mourning good things, because sometimes you can like as a new mom, oh my god, I'm not whew, like, more but so I was extremely happy to be a mom. Does that make like, I don't and at the same time, being a mom, like that, I was the identity change that had to happen for me. So, I was not a very balanced person before I had my child. I was a workaholic. I I just I was not very balanced at all. And the very first time I got a call that my child was sick and that I was gonna need to, like, cancel my sessions for the rest of the day. So, like, I barely took a sick day for myself, and there were times when I had to cancel because my child was sick. And I don't say that to make light of it. What I'm saying is, like, my whole identity, like, had to shift and change with being a mom. Like, and it was a but there was some grief. I had to grieve the old me, and I had to find who I was still as a woman and still as a person, and, like, I can be a parent and still, like, take care of myself and do all those things, and so that is a really, really real thing, okay? You can definitely grieve the loss of a person. Olivia, yes, this came up. And that's where so acceptance is an approval. And in therapy, sometimes the thing I'll warn you about psychics, but sometimes I might have to accept that I might have to find a way to have closure as much closure as I can have without having those answers. Um, I I had a medium once tell me that I was never gonna have children. But they were trying to read me, and I guess I was giving off a "I don't want kids." I don't know why. I don't but for some reason, that's I know there are some good ones. I know people that, like, look at their cards and, that ask cards questions. That's all. Um, and then I would also just encourage people, and this is just general advice, I can't give anyone specific advice, just general tip, that sometimes one of the hardest things I have to come through to is acceptance isn't approval. And so I might have to come to terms, which is harder, with I may never know. And that sucks. That hurts. And I have to find a way to continue to move forward even without having that answer, without knowing why. I compare that to people that have a loved one where they lose a loved one to violence. And and let's say the person is found guilty. And then often the people they want to start the grieving process after that, um, but they still won't get their loved one back. And that process is still difficult. It's still painful. And the court process. I do hope that the Kowalskis are prepared for because it's probably gonna be years of appeal. And no matter what happens, I think they still have a very long road ahead. And I do just hope that, um, Maya is able and, the brother, that they're and the dad, that they're all just able to get some good support, whether it's therapy, whether it's but that just that they're able to have a supportive group that comes around them. Alright, let me see. Alright. Oh. Mm. So guardian ad litems, because I think I don't know if they did the deposition of the guardian ad litem. It might have just been the deposition. They didn't seem all that good. They seemed to be on the hospital side, and they seemed because it was based on the way that they wrote their notes and things. Mm. I liked Maya's attorney better than the guardian ad litem. So guardian ad litems, their role is supposed to be to represent the best interest of the child, but they are going to go on the medical information that's coming from the hospital. And if the hospital is saying, like, we can't find anything wrong, we still think blah blah blah, the guardian ad litem is often going to go with that, which is all right. Exactly. I didn't say that. Um Oh, wow. Alright. This is a good question. Can grief make you more impulsive? So for some people, grief makes them so if it's more impulsive, where like if I'm being more risky, like if I'm not thinking before I act, that might be more of a like dopamine search where I'm trying to find joy and happiness by doing these impulsive, risky things versus if maybe I was really fearful and now the grief and loss, it's caused me to like be more adventurous or put myself out there more. I think that would be different. And it can do either or. There is no right or wrong way to grieve. Everyone does it their way. I do think that if it's to the point where a person can't get out of bed, they can't leave the house, they can't make it to work, they aren't eating, they aren't sleeping, they can't, you know, go to family functions or like if it's to the point where it's impacting functioning, that's where in therapy, in psychology, that's when we say that like that's where like I think professional, like talking to somebody can be really helpful. All right. Ooh, yes. So this is true. So for panic attacks, there are things we can do to activate the parasympathetic nervous system. So panic attacks activate our autonomic, our automatic nervous system, and something sour, also ice, holding ice, or an ice pack to the back of the neck. Like that's like it's a real thing, but it really our vagus nerve, our polyvagal, like our vagus nerve runs from oh my gosh. So it's backwards. The back of the spine all the way down to like the tailbone and that nerve regulates our nervous system and by relaxing that nerve you can have like whole body relaxation. And so ice pack to the back of the neck. Saw it on TikTok, it works. But something sour or something hot or spicy. I think that might be why kids like those I don't know what Takis. That might be why they like Takis so much. Aw. Um, I'm so glad it was helpful. I'm so glad y'all are appreciating this content. And, so Gen P, I don't wanna highlight your comment, but I did see it. And with dealing with trauma and severe depression, and then also being a parent, that's where I think making sure that people have support, around them because, and then that you have to put your mask on first. So that's why I got into therapy to help kids. I wanted to work with kids, I wanted to help kids, and then I realized, um I can fix a kid, not fix, but like I can work with a kid on interventions for 45 minutes to an hour. And then that parent, like the parent can give them like one look that like undoes everything. And so I've shifted more to working with adults, supporting parents, supporting, especially I work with a lot of moms. Being a mom and being a parent or a primary parent or primary caregiver that can be extremely stressful, okay? So, like, right now, my son who keeps coming inside, his father is in the house, okay? His father is, like is right so I'm not neglecting my child like, his father's here, but I am the preferred parent. I am the one where, if I'm getting home after a certain time, I text my husband, like, "Make sure he eats." Because my son, he doesn't realize he's hungry until he sees me. So, like, if I walk through the door at 7:30 PM, the minute I walk through the door, he's like, "I'm starving," but, like, he's been home with his dad since, like, 4 PM. And so, like, being a primary parent or the preferred not prime, but being the preferred parent, also being a single parent. Y'all know I was raised by a single parent. I have a lot of compassion for single parents as well. And so you have to put your mask on first. And that's where in my book, I have a chapter, Helpers Need Help Too. And that's for helping professionals, it's for parents, it's for anyone, but I have to put my mask on first. And I'm sure, I think airlines, they say that for the parents. For the parents in the midst of a crisis, they would want to put the mask on the child first. But I'm no good to my child if I'm passed out because of, lack of oxygen. Like I have to take care of myself first. And self-care isn't selfish. Um, and you find ways to manage it. Um, all right, let me see. Ooh. And your comment wasn't off topic at all. It was really good. Thank you for sharing. I hope that was helpful. I have a video called "Helpers Need Help Too" here too. I think I have a parent resource playlist as well. Some of it might apply, some of it might not. Um, hmm. So I think um, I told you there's no wrong way to grieve. And some people can like read books, they might journal. Some people they might do it. And so some people they might do yoga, okay? So like physically moving your body or Pilates or Zumba, like finding ways to like move your body, doing things that take care of yourself. I think that's incredibly helpful. So I don't even know what I said. I'm so behind on comments. I don't know what I said. No, y'all are the best. Y'all are the best. Um, so I like to grieve with other people. So when I was going through like that dark time, I was so glad that I had my partner where I could just they just hugged me. And we didn't they just hugged me and I just cried and they just hugged me. And that was the best thing. Um, I think within safe communities, so there are some communities that are toxic that will say things that are not helpful. So I don't want to go to I work with someone and I think they're okay if I say this, but they said the best thing someone could say to them in the midst of their grief was, "I'm glad it wasn't me." Like that was literally that would have been like that's honest. That's real. Like this person that you don't want to be in my shoes. And versus people saying like, "Oh, you're so strong," or "I don't know how you're doing it," or like there are some things that people say that just aren't helpful. I have other videos on supporting that. Y'all are y'all are like I was going to do this not live, but something was like you got to do it live because the interaction is so much better. This is true. You don't get to decide how it changes you. You do get to decide what you make of it, though, I think. And that's where, because sometimes grief can feel like grief does take something from you. It takes, and but it doesn't have to control. And that's where sometimes people need support to find ways for it to not control. And, for me personally, so my body, around the time of my significant loss, I feel a little down naturally. I think my body remembers. My body knows that that anniversary is coming up. I have the anniversary in my phone as a reminder because normally I feel a change in my body, and then I go to my phone and I'm like, "Oh, yeah, that makes sense." And that's where I take extra special care of myself. I might just let myself be down for that bit of time, and, so but it can physically impact people as well. So that's why I share. Are you saying I have ADHD? Because we all know I do. My favorite streamers do. So Rob and, Natalie and Emily D. Baker, like all my favorite streamers. I think Recovery Addict too. All of my favorite streamers have ADHD. All right. Sarah, I follow you around the internet. No, I don't. We follow the same people. We do. We follow the same people. I have truly appreciated just being able to share this information and I have so much support and just anyone that's struggling. I just hope that this video gives a little bit of hope that on the other side, like not on the other side of grief. I don't want to say that because the grief and that there are things that I can do to where I'm able to move through it. I don't think grief is something you get over. I don't think grief has to end. I think it gets bigger and smaller. Ooh, ball in the box. Have y'all heard of ball in the box? So the ball in the box analogy. So I'm not gonna use that. Y'all might have heard something weird on my mic. Okay. So we're gonna pretend like this is a ball. Okay, we're gonna pretend like this is a ball. And um when grief happens, it's as big as it can possibly be. And then that there's a box that's pain. And that if there was a box around this, every time it hit the box, there would be pain, 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 pain. And right after grief, or there's things that can trigger to make the grief get bigger, it's pain, pain, pain all the time. But as time, as I cope, as I manage, it gets smaller and smaller where it might not hit the pain points all the time, but there are definitely times that it hits. And so ball in the box, I think you can find it on YouTube, you can find it here on TikTok. It is a great analogy that there are these pain buttons that we have and that grief will sometimes touch it. And um I think that pain is it's still there. Ah, that's there. And being able to find ways to work to just I say work through it because I don't think it's something that you get over. I don't think it's something that has to end. And by having that approach, people don't have to feel bad about still grieving. And that's actually good. So I grieve what I love. If I didn't care about someone and something happened to them, uh, it's not that I'm like, but like it wouldn't affect me because I didn't know them. I and there are celebrities that have passed and I adored them. I was like, "Oh my gosh." And it did. It impacted me. Not in the same way it impacted their family or anything like that, but it was like that was sad. That was sad to hear. Um but over time, what grief can do is it can get easier. It is a roller coaster, so it can get easier than harder, and it doesn't mean that you're doing something wrong, okay? I hope that helps. I hope that helps. Um, alright. I hope y'all enjoy the rest of your day. Bye.